Rose Naluoga lives with her large family in Lubaje village in Kayunga district, about 2 hours away from Kampala city. At 32, she's the mother of 12 children. Naluoga says since she first gave birth at 17 in 1995, she has been having a baby every year since then.
I am not adding more children. I am stopping with these twins.
The eldest of her 12 children is now 14.
Nachintu is 13, Betty is 12, Brian is 11, and Nalu is 10.
Although Naluoga has heard about modern family planning methods, she says she has never used it because she suffers from stomach ulcers. Together with her husband, they are subsistence farmers and live off the land to raise their large family. In the same village lives 30-year-old Rona Atire. She started having babies at 15 and now has 10 children. Atire's last born is less than a year old and the oldest is 10. Her argument for not using modern birth control methods is because she's afraid after hearing so many bad stories about it. Studies show that the average Ugandan woman will have up to 7 children in her lifetime. And with one of the highest fertility rates in the world, the need for family planning cannot be overemphasized. But only a handful of Ugandans eligible for family planning are using it. Contraceptive use in Uganda has remained low at 23% in the last decade, though there are indicators that this number is going up.
I think that's a good indicator that family planning use is increasing, and therefore people can have children when they are able to, when they wish to have them, when they can afford to have them, and when their bodies are able to handle the stress of childbirth.
Birth control, also known as family planning, enables couples and individuals to decide freely and responsibly the number and spacing of their children. But unlike these women who are limited by their negative beliefs and attitudes on family planning, studies in Uganda also show that 4 in every 10 women want to space or stop producing more children but lack access to contraceptives. The result has been the 1.5 million unwanted pregnancies and over 500,000 unintended births every year. Over 1 million children are born in Uganda every year, and over 300,000 induced abortions are carried out every year, most of which could have been prevented with more contraceptive use.
The whole issue of rapid population growth can be sorted out by good education, skills development, especially for the girl child.
Government, under the Population Secretariat, launched the National Population Action Plan in May as a tool to implement the National Population Policy that was passed 3 years ago. The policy identified key issues for immediate attention, such as the rapid population growth rate, reproductive health rights and needs, low male involvement in reproductive health, early marriages and high teenage pregnancies, low girl education, harmful cultural practices, poor infrastructure and lack of access to social services. But the cost of not meeting the huge family planning gap is already putting great strain on government's ability to provide social services like education, health, housing and land.
And we want population to grow in a rate that really meets the needs of the people. And the family size reflects the choices of women. So for women and couples to have choices, they need to be able to plan their families and space them.
Uganda's population is said to double every 20 years, and experts say the country is projected to have 60 million people by 2030 and eventually hit the 100 million mark in 2050.
They told us education was free, but they are charging us, and some of the children are not in school. Even food is hard to get.
Experts advise government, civil society and leaders at all levels to invest more in family planning if such women and their children are to lead quality lives. and Natukunda, NTV.
Hey,